Hello all, this is Sharon from Cape Junction. Chris and I will be receiving a new post-op referral with a subacromial balloon implant. We didn't know much about the surgery and didn't know what the post-op protocol was, so I'm here today to present the post-op physical therapy protocol following a subacromial balloon implant. Rotator cuff injuries are the most common of the shoulder injuries. They cause motion loss, shoulder pain, and result in disability. Surgical options for rotator cuff tears include subacromial debridement, bursiectomies, bicep tenodesis, partial tendon repair, capsular reconstruction, a reverse total shoulder arthroplasty, or the balloon spacer implant. Balloon spacer implants are used on massive rotator cuff tears that are considered inoperable. Massive rotator cuff tears are greater than 5 centimeters and involve 2 or more tendons. 10 to 40% of rotator cuff tears are considered massive, and 6.5 to 30% are considered inoperable. A rotator cuff tear is considered inoperable if there is a superior migration of the humeral head, the acromio-humeral interval is absent, or if there is greater than 50% of fatty infiltration of the rotator cuff muscles. The subacromial balloon implant is biodegradable and is fabricated from a copolymer. It can be performed under general anesthesia or a local anesthetic. Arthroscopic insertion requires general anesthesia, and the fluoroscopic guidance can be performed with a local anesthetic. The balloon spacer assists in restoring biomechanics. It helps to restore the force couple of the teres minor and the subscapularis. It increases abduction and functional active range of motion. It decreases pain, depresses the humeral head, and reduces the friction between the acromion and the humeral head. The balloon begins to degrade at 6 months, but can remain inflated anywhere from 6 to 12 months. In animal-based studies, soft tissue replaced the spacer in as little as 6 weeks. These are 3 studies regarding the implants. In NAPIC in 2021, they looked at 39 shoulders, mean age 69.8 years, with a 32.8-month follow-up. There was significant improvement in pain scores, with improved active range of motion and improved acromial-humeral distance at 3 years. In another study by NAPIC in 2021, a mean age of 65.2 with a 22.1 follow-up, there were significant improvement in all clinical and functional scores. 80.6% of the participants were satisfied with the outcomes, and 83.9% were pain-free at the last follow-up. In a study by Fanziaio in 2021, they looked at 270 shoulders, which had improvement in joint function at 6 months and continued joint function at 3 years. So we are now on to the physical therapy post-op protocol. This is a relatively new procedure, and I had problems finding protocols. This is the only protocol I could find, and it is from OrthoSpace for their in-space implantation. Of the research I read, although they did discuss post-op physical therapy and NAPIC did emphasize the importance of physical therapy, there were not any details. If another procedure is performed during the implantation, the protocol for the other procedure must be followed. This protocol is to be used when the balloon spacer is the only procedure performed. Phase 1 is from 0 to 2 weeks. The surgical shoulder needs to be in the sling full time. However, the patient may remove the sling for short periods of time when they are in therapy, sitting, toileting, or changing clothes. They must wear the sling while sleeping. Passive range of motion and active assisted range of motion for the scapula, neck, elbow, and lower arm is to be performed in therapy sessions. Forward flexion and abduction are limited to 60 degrees. All motion should always be pain-free. Use pain as a guide. Phase 2 begins at week 2 and progresses through week 6. The sling is discontinued. The patient has home stretches for HEP, including cervical, shoulder, internal, and external rotation. Scapular control is introduced with scapular retractions and scapular retractions with external rotation. Active range of motion with gentle passive assist in clinic, along with pulleys and finger ladder in the clinic, and at home, table slides and wall slides. Continue with active work, overhead active work with canes. Toward the end of the 6th week, begin light strengthening with TheraBand and light weights. There is no power work for at least 3 months post-op. Phase 3 begins at 6 weeks and continues for 6 months. Start progressive resistance exercises with weights and heavier TheraBands. Make sure to include deltoid strengthening in the protocol. The proper 2-to-1 ratio of scapular thoracic rhythm and controlling shoulder elevation during overhead exercises and activities should be a primary focus. According to NAPIC 2021, attaining and maintaining proper scapular thoracic rhythm is essential for proper glenohumeral joint stabilization and control. Continue with phase 3 protocols for 6 months, concentrating on progressive resistance exercises, scapular stabilization, and deltoid strengthening. The subacromial balloon implant appears to work well as a standalone procedure. They also work well as a temporary option for a preparation for further surgeries or in conjunction with other repairs. In the research I read, most of the concurrent surgeries were bicep tenodesis and debridement. The balloon insert also can easily be progressed to reverse total shoulder arthroplasty. In the research I read, about 10% of the participants moved forward with a reverse total shoulder arthroplasty before the study ended. More long-term research is needed for the procedure, and more research is needed for post-op physical therapy protocols. If you have any questions, you can reach me by phone, email, or Mango. Thank you for listening.